sweeping the room. The only thing that I'll be using is this right here as my mar. Actually, all right. Hand hygiene. Patient 6 rights are patient medication, time, route, dose, documentation. Alright. Rick Winters. Alright, let me pull up his medication. Got it right here. Rick Winters, TST, tuberculin skin test. Taking 5 units of tuberculin, purified protein derivative. Alright, and forearm, checking the expiration date to make sure that the medication is not expired. Alright, it's not expired. So, hello, I'm Nurse Avery. May I have your name and date of birth, please? Okay, check the bracelet, scanned, now it's onto the MAR. Okay, and then I'm just going to double check the medication that I'm giving him. Checking the expiration date. The right unit. Alright. Okay. Alright, so I'm going to tell you about the medication that you're going to be receiving today. You're going to be doing a TST test, which is a tuberculin skin test. The medication that you're going to be taking today is, the generic name of the medication that you're going to be taking today is tuberculin purified protein derivative. The brand name is Turbisol. The reason why you're taking this medication is to see if you have the Mycobacterium tuberculosis in your system. Contradictions and interactions of this medication is if you have HIV or if you became infected with TB within the past 2 years. Some side effects of this medication is bleeding on the injection site, which will be in your forearm, and if you have a hard red lump, and you're going to be taking 5 units, which is 1 milliliter. Do you have any questions about what's about to happen? Alright, good. Okay. Just take it down here so you can see. So, right before I do it, I'm going to perform hand hygiene. And then I'm going to apply my gloves. I'm going to double check the medication on my MAR. Checking the expiration date, make sure that it's the correct unit. 5 units. Alright. And like I said, I'll be wearing gloves at this point. So, yes, I'm going to go down so you can see me. Alright. So I would clean the site. All around with alcohol prep. I would have his arm like this, and then I'm going to make sure that it's 3 to 4 fingers down from the antecubital space, and then a full grip for the wrist. Okay, so I'm going to scan my medication right before I give it to him, going into the MAR. I'm going to open the package. I'm going to double check that it's at 5 units, which it is. Okay, so you're going to be, there's going to be a bleb, which is just like a little fluid-filled sac on your skin. Do not be alarmed. Alright, when I put it in, you're going to feel a slight burning, stinging sensation. Okay? Do you have any other questions? Alright, okay, thank you. So I'm just going to take this out, like so. Again, 5 units. I'm going to go down at a 5 to 15 degree angle. And, okay, push the medication. Make sure the skin is held taut. and we are done. Pull straight out. I'm going to take this. I'm going to take alcohol wipe. I'm going to wipe the skin down just to make sure. Do not rub. Then I'm going to go like so. One hand scoop technique. I'm going to try again. Against that. Then I'm going to close it. I'm going to go into the sharps container. I'm going to place it into the sharps container. And then I would perform hand hygiene. I'm going to stay and I'm going to document. And I'm going to say just to make sure that there's no allergic reaction, to make sure that there's no, instant swelling in the area. And then I'm going to leave, make sure that he's all right and everything. I'm going to leave, and then I'm going to come back, and then I'm going to make sure within 15 to 30 minutes that he's still okay. Then if he is, yeah. So then I would also tell him that he needs to come back within 48 to 72 hours, just to make sure that that you don't have TB. The thing that you need to look for is if it has a hard red lump and is greater than 5 millimeters, then that is typically a sign of TB. But if it's completely flat and it's a little red, you most likely don't have TB. But like I said, come back in 48 to 72 hours, and we'll read your test. Do you have any questions or concerns? Okay, perfect. Thank you. Have a nice day.